Hello, my name is Dr. David Eisen. I'm a family doctor. I do low-risk obstetrics. Welcome to video number 3 in our video series, Pregnant in a Pandemic, Guide to Prenatal Care for Low-Risk Pregnancies. If you pause here or screenshot this slide, you'll see that we have 7 videos covering content of how pregnancy care is different or changed during our current COVID pandemic. This will be video number 3. Weeks 16 to 20, and the content as you see there. I'm recording this for information purposes on May 24th, 2020. So the information that I'm discussing today is relevant today and how we've changed in the last 9 weeks, but may be different when you see this video. Because we are involved in researching the impact of this video series, we ask you kindly to click the link that you can see in this slide to fill out the anonymous pre-survey that will gauge information you have before the video, and we're going to ask you to do the same thing after the video, again, so we can use this series to gauge the impact of the work. Our medical students are involved in this at the University of Toronto, and so publishing what we learn will be an important part of this series. Week 16 to 20. So we've probably previously presented that when we constantly count weeks, we're counting from 0 weeks, this is usually preconception, to 40 weeks, which we say is term, 40 weeks from the first day of one's last menstrual period. And so when we count weeks in this videos, it's 16 to 20 weeks from the first day of last period, or 16 to 20 weeks dating from a dating ultrasound done in the first trimester, discussed in a different video. At weeks 16 to 20, there's a possibility of doing your OB visit with your care provider, that is to say your midwife, your family doctor, or your OBGYN, by phone, by video, or in person if there has not been an in-person visit up till now. There are things in the 16 to 20 week visit that you can see on this slide are important for your care provider to get assessments of. So if you go from the top of the screen, you can see that blood pressure measurements are important to get. There has been screening blood work often done at 12 weeks and perhaps previously reported to you in a different video, as well as ultrasound. So first trimester screening, if it was done, would have been done already around 12 weeks and reported to you. For the physical exam that you can see on the in-person line in the middle of the slide, there are things that are assessed in the office in person that we're finding very hard to assess over the phone actually, and this does come from having tried. But things that measure your weight, your blood pressure, and the actual size of the growing fetus, this is to say the symphysis fundal height, the height from your pubic bone to the top of the uterus, that is measured by your care provider, either manually or by tape measure or by ultrasound. You'll see all these different techniques, and you'll hear the fetal heart rate auscultated, most often with a Doppler ultrasound tool that can hear the baby's heartbeat, and I'm told that is one of the more pleasurable and very important parts of the visit, certainly for the pregnant woman coming in. And at the bottom of the slide, you can see the missed follow-up. So if you've been ill or there's been a missed appointment, your provider can give you online resources or set up a conversation over the phone where you can track the progress of the pregnancy without actually having to come into the office, especially if you're ill or feeling unwell. It is widely talked about and probably very well known that during your pregnancy, there's things that are sort of blanket recommendations we make to people. Taking prenatal vitamins, and this is often recommended from before the time of conception, and very often when pregnancy is unplanned, as soon as pregnancy is discovered. Signing up for prenatal classes, there'll be a slide later on in our presentation about how to access that now during the COVID pandemic, because our classes that we usually run in the academic center are not running in person. Dental checkups are important when you're pregnant, but they're not happening in person in the dentist's office as of May 24th. And we are currently planning the reopening of much of society, and so that may change by the time you see this video. There are a couple of vaccines that we recommend when you are pregnant, depending on what time of year you are. This is May, so we're not having an influenza vaccination program now, but we will certainly have one in October, November for seasonal influenza. And there's also pertussis vaccination, which your provider will recommend to you around 28 weeks. You can have a discussion with your provider about cord blood banking or donating, which is a certainly good thing to talk to your provider about. And this observed good hand washing. Now that we're in the middle of COVID, you will see that the hand hygiene becomes such a key part of not only your visit to your provider, but really every aspect of day-to-day life, to include going and filling up your car with gas or going to get groceries. This washing your hands before and after becomes a very key part of health maintenance, and not just when you're pregnant. There are common issues that really make women uncomfortable when they're pregnant. You can see from the slide here: nausea, vomiting, bleeding, constipation, back pain. And I know that in a previous video, there's been discussion about nausea and vomiting and bleeding. And in this one, I'll say a word about constipation when you're pregnant and back pain when you're pregnant. It seems that constipation is a really common symptom that women suffer from when they're pregnant, and it's a discomfort that you don't really have to suffer. And the ways to avoid it, I think, are, if you have a look at the slide recommends strongly that you're very, very well hydrated. Now the summer's coming, so even more attention to hydration, and water is the best way to hydrate. And of course, fiber intake, which you can see here with cereals, fruits, and vegetables. There is a powder called PEG. One of the brand names is Restorelax, but there's multiple brands of PEG. And PEG is a powder that is safe for mommy, safe for baby, mixed up in water and flavorless, that can draw water into the bowel. And so it can really be a very big help for you if your bowels slow down when you're pregnant, and they're literally expected to. Having PEG even every single day of a pregnancy is safe for mom, safe for baby. You can talk to your care provider and your pharmacist about PEG. The slide also says Metamucil, which is essentially a fiber supplement. Back pain is a very common symptom when you're pregnant. There's no question that when the growing fetus grows into and above the pelvis, pressure and stretch is put on the pelvic ligaments and the ligaments that hold your entire pelvic architecture together. When these ligaments pull or stretch or strain or become loose, you can feel that as pain when you move, pain when you turn over in bed, pain when you bend over. The slide alludes to good posture, and I would focus on also bullet number 2, which if you were to Google back pain and pregnancy, you will get a whole bunch of videos on stretches you can do on the floor that greatly relieve the pressure in the sacroiliac ligaments and the muscles that are just above, sort of at the back and the bum, that can stretch those muscles and give you lots of relief. So I would not hesitate to do the back stretching exercises you find online. If you Google prenatal yoga, you'll see all kinds of online yoga classes that you can do. And again, the key there is gentle movement that keeps the ligaments and muscles in a good, healthy state of stretch and activity, and not letting the back stiffen up. Before 20 weeks, if there is an obstetric emergency, this is covered elsewhere in another video, but at our center, under 20 weeks, emergencies, and the big one would be bleeding in pregnancy or water breaking in pregnancy. These would be seen in our emergency department. Over 20 weeks, obstetric emergencies are seen in our labor and delivery triage suite, which is on the 2nd floor of the hospital, and in every hospital in a different place that you can easily see on the hospital website. Fetal movement is expected mostly after 20 weeks, so it might not be the emergency to consider from 16 to 20, but I do think the bleeding, contractions, and water breaking may cause you to get medical attention promptly, either from your care provider or in your local emergency department. There are some questions that women have asked us a lot about during COVID, so I'm going to try and answer some of those. What kind of symptoms will I have if I'm COVID-19 positive? It's very clear, and if you read your daily news, you'll find out that you can be COVID-19 positive with no symptoms whatsoever. You could be COVID-19 positive with very mild symptoms that feel like a cough, cold, or even an allergy attack. And then there's severe COVID symptoms, which relate to your breathing. And if you are ill or having a hard time breathing or finishing a sentence, that means that the emergency room is the place to be assessed so they can find out what your oxygen status, your heart rate, your blood pressure, and your temperature are. Mild symptoms of COVID that are listed higher up in this answer could be discussed with your care provider in OB, or if it's not your family doctor, then your family doctor. Telehealth is also available by phone to answer questions, and there's an online resource as well, COVID-19. What happens if my ultrasound results are not normal? So at 12, classically, you may have had an NT ultrasound, which has been discussed in a different video. At 18 to 20, you will have a detailed anatomy scan ultrasound, which looks at many parts of the baby's anatomy to look for health, well-being, or something that doesn't look normal to the radiologist. If that's reported to your care provider, they will contact you, whether that's by phone or email or video, or by asking you to come into the office to discuss next steps, whether they need to repeat the ultrasound or ask a maternal fetal medicine specialist to look in a different way. That will be followed up by your care provider to ensure that the right answers that are raised by this ultrasound are finally given definitive answers. As we discussed earlier in the video series, this video series is hoping to have impact in improving care for women during pregnancy, especially during pandemic. So there's a free survey that we hope you took before this video, and we're hoping you're going to click on the link here to fill out the post survey so that we can figure out how well these videos helped in terms of caring for you while you're pregnant during pandemic. There are multiple resources for you, and if you click the link here, you will get a list of these. So in addition to filling out our survey, we welcome you to get our list of resources, which are reliable and evidence-based and hopefully helpful for you to have your pregnancy during a pandemic situation. Congratulations for getting this far through the video series. You've done a great job. Video 3 out of 7. Video 4 is coming up next. Doc, I'm beginning to show. This is from 20 to 28 weeks. So thank you so much for listening, and we're wishing you a happy, healthy pregnancy.